behalf of Camano's Cancer Institute, we are one of the 39, I don't know why these slides on here are clicking away at me, but anyway, one of the 39 National Cancer Institute designated comprehensive cancer centers, have been since the late 1970s. But we're also home to the National Center for Vermiculite and Asbestos-related Cancers, or NCVAC, as it's colloquially known here. We've had a long interest in this disease. One of our colleagues in the community routinely, Dr. Michael Harbut, who many of you know, was routinely referring patients to us with mesothelioma. And as we began discussing things with him over the years, it became clear that there was a unique problem in this area. We're all aware that Libby, Montana has been devastated by the W.R. Grace mines and the excuse me, and the vermiculite that's contaminated vermiculite that's mined there. What most people are unaware of in Michigan is that one of the major consumers of that ore was the Zonalite Corporation here in Dearborn, and literally millions and millions of tons of loose fill insulation was created, popped, if you will, if you understand how vermiculite is made, insulation is made. It was made here in Dearborn, which is, you pass Dearborn coming from the airport, it's right off of downtown. And there are, at last count, somewhere in the order in southeast Michigan alone, 800,000 homes with loose fill insulation, my own included. And it's not something anybody chooses to do, but that's what it is. We all have it here. So what we'd like to do, what we do with Michael, he'll see literally hundreds of patients who come in with varying degrees of exposure. We have a standard way of working them up, a standard assessment for them that's brought forward, and anybody who has any changes in any suspicion of a development of a malignant disease is seen as part of our multidisciplinary team here, where we have pulmonologists, radiologists, oncologists of all three stripes, of thoracic surgeons, meeting every week discussing all of our new cases. And I would say probably each week we have at least one or two patients that come down from the Environmental Health Center with nodules that have changed or nodules that are there on chest CT that haven't been appreciated previously, and we go through the process of working these patients up. And thankfully most of them turn out not to have malignant disease, but many do. And when they do, it's when things get tragic. And I think if we can bring home in my talk today, the one message is we have not made great progress on the therapeutic side. We are still struggling in the extreme. In fact, for many, many years, mesothelioma was in the cooperative group tradition in the United States, where it was categorized was in amongst the sarcomas, and it was managed by sarcoma medical oncologists. And starting in the late 70s, early 80s, those of us in the cooperative groups moved it into the thoracic programs. And one could argue we could do that because we wanted a disease in our compendium that made lung cancer look good therapeutically. And unfortunately, mesothelioma did that, and unfortunately still does. It's a very difficult disease to treat, and therefore every conceivable effort we have should be directed at early detection, prevention, markers, screening for this disease, so we have a chance to get at it when we can do something. Because once we have advanced disease, the chances of making a substantive change in that patient's outcome become pretty small. So again, on behalf of the Cancer Center, I welcome you here. I can't promise you all the excitement of the Elite 8, which is occurring downtown, but I can welcome you to this is something unusual. We actually can see the sun today. It usually does not come out again until May, but and those of you who are not from these northern climes, things can be judged here. Tomato planting season starts Memorial Day here, so you know this is in the colder climes. But at any rate, thank you for being here. Thank you for your support. Thank you for your continued efforts against this disease.